What's up, guys? YouTube world out there, fans of Dyer Armory. My name is Dave, and I'm the owner operator of Frontline Medical Defense. And David asked that I come by today and kind of give you guys some insight into medical kits, how we design them, maybe the differences between some of the medical kits, and then maybe some of the reasons why you're going to have one, where you're going to have one, and a couple classes that you can take that are going to be awesome for the civilian, the immediate responder, all those kinds of things. So without much further ado, we're going to get into, I think, two classes that literally everybody should have. And those classes are CPR and Stop the Bleed. So those are two classes that are widely available. They are easy classes. Typically, Stop the Bleed is free. I know I teach it through my business as the instructor, and we typically do not charge. Sometimes we'll go to a business and charge, or churches and whatnot. And then the other is CPR. CPR, typically there is a fee associated with CPR, and that can be anywhere from $30 to $60, just kind of depending on the business you're taking them from, or maybe your company you work for is taking. I know a lot of lifeguards, teachers, all that kind of stuff have CPR as a requirement, but those, I think, as a civilian, or the new term kind of is the immediate responder, I think those are the two base classes that pretty much every single person should have. Stop the Bleed is a newer curriculum after some of the school mass shootings has come to light. CPR has been around for a while. It's much more widely adopted. It's a much broader taught curriculum, and we're trying to bring Stop the Bleed into that light, into that well-known arena. And I think we need to remove some of the stigma of treating hemorrhaging bleeds or massive hemorrhage, and we're going to be able to save a lot of lives. CPR, again, has been around for years, and it's well received. So we need to get Stop the Bleed on that same level. So why do you need these two classes? So CPR, cardiopulmonary resuscitation, is easy to sell people, right? So you see somebody drop dead, a family member drops dead, Thanksgiving dinner, right? You can start CPR and call 911 and have them respond to you. And you can keep that blood pumping around the body, hopefully giving them a chance to survive until they get to definitive care. Having an AED along with that is awesome, because then you can shock somebody out of the most common savable rhythm, VFib, that the person may be in. So CPR is great, right? The national standard for a response for first responders is 7 to 10 minutes. So what that means is that when you call 911, you recognize there's a problem, you call 911, it's going to typically take somebody 7 to 10 minutes to get to wherever you are. It could be shorter, it could be longer, but the national average is 7 to 10 minutes. So what can go on in that 7 to 10 minutes? Well, if you're a bystander or the immediate responder and you do nothing, well, then nothing's being done, right? So if they have dropped dead and they're not breathing, their heart's not pumping, their brain is just continuing to die until they're going to go into asystole and death and not be revivable. So CPR is giving them that chance, that oxygen to continue to pump around their body to give the cells what they need and get out the bad stuff. So CPR is fantastic. The other end of that to me is Stop the Bleed. Stop the Bleed is a nationally recognized program that's gaining popularity, but again, the standard response is 7 to 10 minutes for a first responder. You can bleed out in 3 to 5 minutes. You can be unconscious in 60 seconds. So again, what does that mean? Well, if you become unconscious in 60 seconds, you can't help yourself, right? You need to have a tourniquet close enough to you to be able to put it on and apply it to yourself within that 30 to 60 second window, or again, you're going to bleed out, you're going to become unconscious, and you're going to die. So we're trying to get the Stop the Bleed into a more mainstream, more easily accessed bleeding control kits kind of everywhere. A lot of the schools have them. Airports are starting to put them all over the place. But again, it's got to be that general effort from the whole community that we did with CPR years ago. We need to do that with Stop the Bleed. I know I posted after the Uvalde shooting some stuff, and I got comments like, hey, why don't you try to not capitalize on the school shooting? And I said, hey, I appreciate your input, but that's where Stop the Bleed came from. It came from the Sandy Hook school shooting where all those children died. The doctors got together and said, how can we stop these children from dying, right? There is a difference between a non-savable life and a savable life. So if you get shot in the head, you're most likely dead, and we can't do anything about that. But if you get shot in an extremity and you sever an artery, that's where the tourniquets come in, and that's when we can do something. So we need to get it out of, don't capitalize on this, don't, try and make money off of that. You need to have the training and you need to have the equipment to be able to save a life. To be able to stop the bleed, you need to have the knowledge, the skills, the ability, and an opportunity to put it all together and make it work. So the same thing as CPR that is so widely known, pretty much everybody knows how to do CPR. It's a pretty simple task. Stop the bleed is kind of the same thing. Apply a tourniquet within that 30 to 60 second window and hold pressure, pack a wound, all those kinds of things are taught within that 2-hour class. That's typically free or low cost. The equipment is a little bit more expensive for Stop the Bleed. Typically a kit like we sell is around $60. This is a vacuum sealed one, and it comes with a tourniquet and a pressure bandage and some wound packing gauze on the back. They're a little more expensive than just a CPR mask, which is like $5, or if you do hands-only CPR, where literally all you're doing is just pushing on a chest, right? That's free. It doesn't cost any money for you to just pump on somebody's chest. So there's a little bit higher a barrier to entry with a Stop the Bleed kit because you need at least a tourniquet and a wound packing item. And typically those run, again, a tourniquet's about $30 for a TCCC recommended tourniquet like the North American Rescue CAT tourniquet. But again, I think they are definitely worth their money. I carry them multiple places. And so with saying I carry them multiple places, I want to get into, well, where do you carry a tourniquet? Or where do you carry a first aid kit? So to be able to have one within that 30 to 60 second window, it's like you almost need them everywhere. So in your garage, if you're doing woodworking or working on cars, just maybe in the kitchen or wherever you keep your normal first aid kit. If you're an avid fisherman or you like to go out on the boat, I've run calls where people fall off the boat and get hit by the prop. That's always a possibility. So again, you need to have these first aid kits or these tourniquets or the Stop the Bleed kit almost wherever. Because if you don't, you're going to be missing out on the opportunity to save a life. Maybe you're going to choose to carry one on you. There are ankle kits. We make the Adventure Mini EDC that is on body carry. We put it in a pocket. And this has a SWAT tourniquet in there, stretch, wrap, and tuck. It's not TCCC recommended, but it can still stop a bleed, hopefully. So again, you got to think about all of the places. And unfortunately, you probably need 4, 5, 6 first aid kits. And I know that's a lot for some people, and they're not inexpensive. But again, if you're not around the medical item that you need within that 30 to 60 seconds, you're kind of out of luck. So again, in your house, in your car, I have a MOLLE panel that's under my front seat that I carry a tourniquet on. So again, I've run car wrecks where people are entrapped in the vehicle and then we have to cut them out. If you were to suffer a massive hemorrhage while you're in that position, you can't get out of your car to go get your medical kit. Have something in reach to stop the bleed. So again, on your person, in your vehicle, in the kitchen, on the boat. If you're going shooting, I just got back from the gun range zeroing in a new rifle, and carried my range bag in with me, or my range medic kit, and it's got the tourniquet, it's got wound packing gauze, it's got hemostatics, shears, a little bit of everything to be able to control those bleeds kind of wherever you are. So then I think based off of that, right, a lot of the questions I get is, well, what medical kit do I purchase? We sell 10 or 12 different ones on our website, and it's a pretty common question I get is which one do I buy? So I kind of think there's 3-ish different types of medical kits, and this is just my personal philosophy. First one being just something I would call a Booboo kit. There are no tourniquets in here, there's no wound packing specific materials, but it's just got your basics of what you might need with your kids, or just in the car a little bit. But again, it's not going to have your life-saving materials in here. So we can pull it out and kind of go through a few things in here that, again, I would think make this more of a Booboo kit than a IFAC or a trauma-centered kit, if that makes sense. So we just have some normal 2-inch cling, so that way you can wrap up a wound. We've got just normal 4x4s. Again, we can place that over a minor wound and wrap it with the cling. Gloves, PPE is always an important item to have in any first aid kit. Years ago when I was going through my EMT school, I had an instructor tell me, if it's wet, sticky, and not yours, don't touch it. So to me, that goes for snot, blood, vomit, urine, whatever. I don't want to touch any of it. So then we've got just basic medications. Aspirin, Tylenol, Benadryl, and then here we keep a forehead thermometer. So I would say one thing that we put in all of our first aid kits that I think can be life-saving is aspirin. A lot of times we run chest pains or heart attacks, and the first drug that we give a lot of times is aspirin if there's no allergy to it. Kind of makes your blood not so sticky, helps a clot from forming. So if you call 911 saying I'm having chest pain or a heart attack, they're going to tell you to take aspirin. I can't tell you how many times I've gone to somebody's house and I say, hey, have you taken aspirin yet? And they say, well, no, I don't have aspirin. So 324 of aspirin chewed will help make your blood not so sticky if you think you're having a heart attack. And then an ice pack, and again, just some general use Band-Aids. So again, to me, there's a few things: a splint, a CPR face shield, hand sanitizer, sting swabs, tweezers. But again, that to me is a Booboo kit, right? That's not going to save somebody's life if they get shot. So that might be like my wife carries this in her purse or in the pool bag. Minor scrapes, bumps, bruises, rolled ankle, those kinds of things are going to be in what I consider a Booboo kit. Again, it's not going to save a life, most likely. A step up from that, I think, is the IFAC. So the IFAC stands for Individual First Aid Kit, and it's designed to be your first aid kit. Now we make some that have multiple days worth of stuff. We go camping, off-roading, some of those things. And so we design them to have multiples of things. But it has the Booboo stuff in it, and then it also has a tourniquet and gauze and stuff like that designed to save a life, right? So again, we're talking the different types of first aid kits. So this might help you with your system of where do I put one? Okay, well maybe in my purse or my glove box I have a Booboo kit, and then on the boat I've got more of an IFAC, or Molly panel in my car I have my IFAC. But again, so we've got that TCCC recommended tourniquet. We've got a wound packing specific gauze. If you don't have any of these, the North American Rescue wound packing gauze is specifically designed to be inserted into the body to pack a wound. Easy open, it's Z folded in here. It pays out really well versus a rolled gauze. So the rolled gauze you can pack a wound with, but this is just easier. And they're $5 or so, give or take. So again, we're talking the difference between the Booboo Buddy and a IFAC, something that's going to have kind of everything. So we've got all those same medications that this has. We've got the aspirin, Benadryl, and then all of the standard Band-Aids and all those kinds of things that are in this one are also in here. And then as we build them, we try and think through the March algorithm and think, how can I cover all of the bases of March, or massive hemorrhage, airway, respiration, circulation, and hypothermia or head injury. If you're not familiar with March, I would recommend looking up that acronym. And when you build a kit, if you're building your own, try and cover all of those bases in conjunction with the standard, aspirin and pain relievers and Band-Aids. Again, we've got our PPE. We've got a blanket for keeping the patient warm. If they do have some sort of traumatic injury and they've lost a lot of blood, we need to keep the patient warm, or it's just going to make things worse. The clotting cascade doesn't work as well. All these things start to get worse, and we need to keep the patient warm if we can. So again, this is an IFAC. It's a little bit of everything. And this is what I carry in my vehicle. And if I'm out and about, this is what I carry in my pocket. To me, again, my philosophy, the third type of first aid kit that I think there is out there is what we call a trauma kit. So the trauma kit is pretty much going to be solely based around traumatic injuries. So this kit doesn't have Band-Aids in it. It doesn't have Tylenol. It doesn't have any of those creature comforts. There's no Band-Aids, any of that kind of stuff in here. It's solely designed for traumatic injuries. So again, we've got the cat tourniquet, we've got wound packing gauze, we have an Israeli bandage for the compression, again, keeping somebody warm, PPE, and then an NPA, a nasopharyngeal airway. And again, this one is designed pretty much solely for trauma, right? So if somebody comes up to you and say, hey, I cut my finger a little bit, I got a paper cut. Well, this isn't what you need. You need something like this. And again, that's why I think there's the three different kinds of kits. Obviously, there's more than that out there, and there's tons of different manufacturers, or you can take somebody's kit, even go to our website and go through our build list, and you can buy every individual item and get what you need. I'm fine with that. I think it's all about getting the information out there. But I think when you're designing a kit, buying a kit, building your kit, whatever, you need to kind of go through some sort of thought process of, okay, well, what do I want it for? Do I want just some creature comforts with my family? Do I want something that is all encompassing? Or do I want something that is just for trauma? So when I was at the range earlier, I brought this in, right? This is all I need. I don't need Band-Aids. I don't need medicine. I'm there for an hour, and I need to be protected if something happens. So again, you need to look at your use. What am I using this medical kit for? Am I going to use it for family and just general use? Am I using it to make sure that everything is protected? Or is it just trauma related? And then on top of that is, okay, well, where am I going to keep it, right? So we talked about that earlier. My car kit, you can keep it in your house to be your more complete first aid kit, right? The first aid kits you're going to go into Walmart and spend 15, 20 bucks on. They've got nothing but like 1,000 Band-Aids and some Tylenol in there. Typically, they don't have tourniquets in there, and if they do, I'd almost put money on it that they're not TCCC approved or recommended tourniquets. All right, so now you've picked out your kit. You know where you're going to keep your kit. I think another good item to have with you is some sort of paper or assessment aid. So this is a Right in the Rain Vital Statistic EMS notebook. So if this is in your book or in your car and you pull it out and you find somebody that's been injured, you can write down all this stuff and then rip it off and maybe give it to the EMT or paramedic that's showing up. So it's got the date, the time, the patient address, the date of birth, their chief complaint, their level of consciousness, all these kinds of things. So this will kind of help you do a focused exam. If you know nothing else about first aid or EMS or helping somebody medically, there are some other aids out there that you can purchase that will kind of guide you through an assessment of somebody you found that's injured. So again, I think something like this in conjunction with, again, whatever kit it is that you buy and wherever you keep them, is going to go a long way to help you better assess and better care for that patient. So then I kind of want to touch on some of the essentials, I think, right? So we've got all this stuff, we've got a kit, but maybe you don't want one of these things. Maybe you just want the bare essentials to keep in your car or in the house or whatever, right? Because all we really need to do is keep somebody alive from the point of injury to definitive care, right? So typically we're trying to keep that under an hour as an EMS professional, the golden hour. But if you get injured, all I really need to do is keep you alive. If you roll your ankle, that's not going to kill you. If you get a paper cut on your finger, that's not going to kill you. What we need to do is keep somebody alive from the point of injury to the definitive care, the hospital, surgical intervention, whatever it may be. And I think to do that, you need to have at least 3 items. First of those being a tourniquet. Again, this is the CAT tourniquet. I keep harping on this one because it's my favorite tourniquet, super easy to use. I know they've gone over it. There's a million videos on a CAT tourniquet. But a TCCC recommended tourniquet should be, again, within that 30 to 60 seconds of you at all times if you don't want to die from a hemorrhagic injury. After that is a wound packing gauze. Again, we talked about the North American Rescue wound packing gauze. Here is Quick Clot, and this has a hemostatic agent on it. So we're talking $5 versus $50, right? So a big difference in cost, but this one is impregnated, I believe it's with kaolin, and it will actually help your body create a clot and stop the bleed, hopefully more efficiently than just this. However, these work as well. So again, now we're talking, we can put this on an extremity and stop the bleed. And then if you have an injury to somewhere where you can't put a tourniquet on, so your groin, your armpits, your neck, then we're going to go into packing wounds, right? And this is the very basics of stop the bleed and what I think you need to have. And again, we're covering all these MARCH or the MAR points of view. So tourniquet, wound packing gauze, and then some sort of chest seal. So olden days we would take just some sort of occlusive dressing and put it on the patient's chest and tape it down and be good to go. Now there are a lot of commercially produced chest seals. So again, this one is from North American Rescue, the Hyphen Compact Vented Chest Seal. So here is just a comparison. This is the compact, and this is just a regular one. You can see kind of just the difference here in sizes, right? So this will be able to cover more area if need be. And then if you have the ability to get a vented chest seal, that's definitely the way to go. So that way, if you do start to build up any pressure in your chest, this will hopefully relieve it or allow blood to come out potentially. However, you can always burp these or attempt to burp these if the vents are clogged. And then also you can see, right, there's one of these and there are 2 of these. So you always need 2. These are sold in singles, and we've got a ton of these. And these are perforated or whatever together. So you need to have one for an entry wound, and you need to have one for an exit wound. So likewise, if you happen to find somebody with a penetrating trauma to the chest, you need to quickly try and see if there's an exit wound wherever. It might be on the back, it might be on the side, it could be through and through, whatever it is, if you happen to see somebody with penetrating trauma that's not like a knife wound or a stick or whatever, search for an exit wound, right? So now we're covering those things. And then for airway, something super easy to place is a NPA, or a nasopharyngeal airway. The most common thing that occludes the airway is the patient's tongue. So an NPA just goes in the nose and it goes to the back of the pharynx and bypasses the mouth, or if the tongue is occluding, it bypasses that. This is a 28. 28 NPA is a pretty standard size. It fits in most people. And then these come with lube on the back. However, at work, a lot of times I'll just stick the NPA in the patient's mouth, and the saliva in their mouth is enough lube and it goes right in. So again, if I was to have just my bare necessities of something, I would say a TCCC recommended tourniquet, a wound packing gauze, chest seals, and an NPA. With just these items, you're going to be able to cover most life-threatening injuries. I think once you pair those with the knowledge of CPR and stop the bleed, where you have the training to use these things, you're going to be a much more of an asset than you are a liability, right? So the immediate responder, you guys out there, when you are driving around or you're in the mall or you're at daycare with your family, you need to think about you're going to be the immediate responder, right? You're there when whatever it is happens, whether somebody drops dead, a shooting, car through a building, whatever it is that happens, you're there. You're already there. Likewise, that person then has to call 911, that has to go through the 911 dispatch center, the people have to respond. You're in that 7 to 10 minute window when you're already there. So if you have these items in some sort of configuration on you, near you, your kid's pre-K has one and you know where the stop the bleed kit is, you're going to be that asset, you're going to be that immediate responder to help people now, as opposed to that 7 or 10 minutes where if you don't do CPR in 7 to 10 minutes, or if you don't stop that bleed in 7 to 10 minutes, they're going to die. So we need to, I think, start transitioning to becoming an asset in the community and not being a liability, and having the training, the skills, the knowledge, the ability, and the equipment to help people. And again, to be that, the immediate responder and the asset. So if you guys have any comments, or you think you would change something up in your kit, or we missed something, feel free to drop the comments down there and we'll try and comment. StopTheBleed.org is the website for Stop the Bleed. You can go on there and search within a 200, I think, mile radius of where you live, and you can sign up for a class. Again, typically they are free. Some people might charge a couple dollars. Or, you know, if you can get somebody in your community, a shooting range, a church, a lot of these people are trying to put these classes together, and we've taught at a myriad of these different locations. So you need to get the training, you need to have the equipment, and you need to have an opportunity to use it. If you don't have one of those things, you're going to fall short, and then again, you're going to wind up being the liability in the community as opposed to the asset. So get out there, get trained, and if you need anything, you guys give us a holler. Thank you.